as Steve said, I'm with the Centre of Expertise on Child Sexual Abuse, and our organisation, if you're not familiar with us, and I know many of you have heard of us and are using our resources, we are set up to improve the professional response to identifying and responding to all forms of child sexual abuse. We work across both England and Wales. We're an organisation that's funded by the Home Office. We're actually hosted by Barnardo's, but we work independently from both of those organisations. I've been with the centre now for about 3.5 years as a practice improvement advisor. And prior to that, I was in education for all of my career up to that point, and looked after a number of schools that made provision for students with social, emotional, and mental health needs. So we're going to look at the scale and the nature of child sexual abuse, what we know, what the data tells us, and I'm going to take you through that information over the next few slides. And then the resources that I'll mention at the end, all of them are free to access from our website. So I hope if your interest has been piqued at all by what you've heard today, that you will visit the website and have a look at some of the resources. We've got some practice guides, we've got some key messages from research that cover a wide range of themes, and certainly some that are very relevant to the themes that have been covered later in this session. Okay, so what do we know about the scale and the nature of child sexual abuse? I think this slide here is covering the different contexts of offending. Now, what we don't have time to do today is to think about each of these individually and spend a lot of time exploring these. But I think it's really important to think about to not think about these sort of singularly. I think we often tend to have a fairly siloed approach to sexual abuse. And actually there's often an interplay between some of these. There was a review of local authority partnership action plans in 2020. And while we found that nearly all of those local authorities had an action plan regarding child sexual exploitation, only 4% had an action plan and a strategy to respond to child sexual abuse. So it needs a much bigger focus, and it forms the majority of abuse. Most children will know their offender either through their sort of family or friendship network. Yet we sort of sometimes tend to put our focus in areas where we're not saying that it's not an important area, but if you think about perhaps some of the media headlines over the last year, as soon as you put one type of offending in the spotlight, it means that all other types of harm that are happening under that wider umbrella of child sexual abuse kind of get left in the shadows. And what we know is that most children will know the person who has harmed them. We also know that online activity and access to the internet has really accelerated the harms that children can come to, and also connected offenders in a way that was previously unimaginable. So there's a lot to be thinking about in this space. So what do we know? What does the data tell us? So within our team, we've got, I sit in the practice improvement team, we have a policy and comms team, and we also have an amazing research and evaluation team. And they pull data from various resources to produce the next few slides. Our data is really, really robust. It's reproduced by other government departments, and so it's very, very reliable. So what we know is that there is a gendered nature to this type of harm, with 15% of girls and 5% of boys and young men being abused by the age of 16. There are additional barriers for boys. We think that 5% is likely to be an underreported figure because of those barriers. And we know that girls are more likely than boys to seek help when that happens. So just bear that in mind. In terms of context, now for all children, as I mentioned, they are likely to know the person who is sexually abusing them. Most offences are likely to be committed within the home environment, but for boys, abuse by authority figures is more common, and I think we can all probably relate to some of the stories and the sort of high-profile figures that we've heard about in the news. If you think about kind of faith and sports leaders, that's more common for boys to experience harm in that way. Oh, come on, slide, click on, please. Okay, so what we know about those who offend, those who sexually harm children, 92% of perpetrators are male. The data around females is not as secure, but it's about 8%, as you would hopefully guess from the 92% there, if you've got any math skills. With about half of those, so 4% of female offenders offending on their own, and the other 4% co-offending with a male offender. In terms of when the abuse first happens, this data here, as you can see, was taken from a Office for National Statistics report in 2020, and the data was gleaned from a question to victims and survivors about when they recalled their abuse first starting to happen. Now, if you work along that kind of age range there from 3 to 15, that gives you the percent at which respondents recalled the age at which their abuse started. Now, when I first joined the centre, I was really sort of surprised by this data. I think if we think about the headlines, we often think about older children being impacted by this type of harm. But if you were to add up the percentages from 3 to 11, so if we think about early and primary years, and those of you supporting children and families in that age range, that's over 50% of respondents saying that the abuse happened, I guess, before they made that transition to secondary school. And I think, it's hard anyway, as Steve mentioned at the beginning. This subject matter might raise sort of difficult feelings and emotions for people. It's likely, when we look at the data, that there will be people on this call who've either been directly or indirectly impacted by child sexual abuse. But I think when we're thinking about very, very young children, it becomes even more difficult. But there's definitely data that suggests that it's a much bigger problem at a younger age than many of us may ever have imagined. So 1 in 10 children. If we look at this slide, and again, this is difficult viewing, and 1 in 10 children will have endured abuse for more than 8 years or more, and that's a significant amount of their childhood. 1 in 5 between 4 and 8 years, and so for many children, they are experiencing this harm very, very early, and that harm is lasting for an incredibly long time. The earlier the abuse starts, the less likely the child is to recognise it as abusive, and the longer that abuse will continue, and the more serious the offences against that child will be in terms of sort of penetrative offences. So we do know there are additional vulnerabilities that occur within a child's environment, which can increase the opportunities for sexual abuse to occur. So children who live in conditions of neglect are 5 times more likely to be sexually abused than those who do not. Children who spend any time in residential care are 4 times more likely. Now, what we don't know from the data is whether that sexual abuse was the reason that they were brought into care, or because they were then in residential care that increase their opportunities to be sexually abused. But we can't glean that from the data that we have access to. But certainly children who've experienced residential care, there's a higher risk. Children who've got disabilities are at least twice as likely. Now, there's research that's being undertaken at the moment, which is likely to indicate that that's higher, but we haven't got the final findings from that. But children who have disabilities are likely to be overrepresented both as children who are sexually harmed, but also children who themselves engage in harmful sexual behaviour. So other kind of vulnerabilities within a family environment might include children who live in a household where there is an adult misusing alcohol or drugs. Children in those situations are likely to be 3 times more likely to be sexually abused than those children who live with adults who are not using substances. And what we know about children who are sexually abused is they frequently experience other forms of harm, and those other forms of harm are, there's a significant overlap between kind of domestic violence and also emotional abuse. Now, what's interesting when we look at that. So sorry, this slide is basically making that point again, and you can see that the kind of the overlap between other forms of harm, and what tends to happen is that across all agencies we're more confident in talking about these other forms of harm than we are about the sexual abuse itself, and I guess this confidence or lack of confidence in identifying and talking about child sexual abuse really leads to this data that we have here. If we look at the bar charts on the left-hand side of this slide here, what we can see is that sexual abuse is identified at similar levels to sort of both physical and emotional abuse. But there are far lower levels of assessments. So we know it's happening almost as much, but it's not appearing to the same degree in assessments. Then when we look at the line graph, okay, so this is showing you the number of children who have been placed on a child protection plan, depending on categories, since data began. So that's about 30 years worth of data. Now this year, we have nationally just 2,160 children who are on a plan for child sexual abuse. Now just look at the difference to the other forms of harm. Okay, we can see that physical harm is coming down, but not as quickly as sexual abuse is coming down. But the rates, this is against a backdrop of huge increases in the number of children who are on plan for emotional abuse and neglect. So we're just simply not, we're simply not naming it. It's not being identified, it's not being named, and therefore it's not being responded to. And so we've got lots and lots of children who are experiencing this type of harm. They may well be on a plan, but the sexual abuse that they're experiencing isn't named on the plan, isn't spoken about, and we really need to kind of think about how we improve that identification. So in criminal justice, we actually see quite a different trend. So the number of reports of child sexual abuse offences has gone up manyfold in the last 10 years. But this doesn't actually relate to there being more crimes. It's probably more, I guess, related to victims being willing to come forward. There have been some very, I guess, successful media campaigns and other kind of campaigns to raise awareness about this type of harm. And there's been, more confidence for people to come forward. Sadly, what we see though is that the charges, that if we look at that line graph again, the rate of charges has remained fairly static, And unfortunately, there are significant delays between offences being reported and those adults appearing in court and charges being made. And often children and families will be in a space where they're accessing really limited support. And often families, that pressure and that waiting means that sometimes they withdraw those allegations. So it's really important that we understand that during that time we can and we should be supporting children and families. There are some myths about the fact that children shouldn't be receiving support while waiting for a court date. That's absolutely not the case. And there's some really good support from the Blue Star Project about the types of support and counselling that children can access during this time to support them. Okay, so this is our kind of iceberg slide. So right now we know that the number of children experiencing child sexual abuse who are known to services, as I said, that number at the top there, and the number of children on plan, that's been rounded up to the nearest 100. As I said, it's actually just 2,160 children on plan in England. So that's just the tip of the iceberg. If we look at the waterline, and below that waterline, we estimate that 500,000 children in England and Wales will experience some form of child sexual abuse in the past year alone. If we go above that waterline, we see that the service that they're most likely to come into contact with will be the police. And of those 101,000 offences recorded by the police, they will then be 45,000 assessments of children who might be at risk of sexual abuse. The number of children who are then seen by a SARC, a Sexual Assault Referral Centre, is just 10,500, and it leads to the figure that we've already mentioned there at the very top. Now, if you are interested in finding out about the data in your local area, what we have is our data insights hub. Again, if you want to jump on our website, it's really, really easy to navigate. And for your area and your statistical neighbours, you can explore data that will tell you about the number of children who've been assessed for child sexual abuse, the number of children who've been assessed for child sexual exploitation, and how many children have ended up on a child protection plan for the category of child sexual abuse. And again, all praise to our research and evaluation team who've pulled this database together, but you can look at your statistical neighbours and you can look at trends over time. And it's a really, really useful tool, and we're kind of promoting that far and wide, and absolutely free to use. So Steve also mentioned the national panel report that was published towards the end of the last year. The Centre of Expertise was kind of commissioned to do the work for this review, and the findings of the review kind of highlighted a systematic failure across all services. This is not finger pointing to any one particular services. This is all services who were in that safeguarding space, that they essentially were failing children and had a real lack of confidence when responding to concerns about abuse within the family environment. There are 10 recommendations that came out of that report. The government have accepted all 10 of those recommendations and are working on those. And there are also 6 recommendations for local safeguarding partners, which I'm sure some of you on this call today will be familiar with and working on. And again, our role is really here to kind of help support colleagues to respond to those recommendations and really improve confidence in this space. So how do we improve our identification? Well, one of the things that we have produced is a resource called the Signs and Indicators Template. I'm going to take you through that. But But this was also highlighted in the national panel review that practitioners needed to have a better understanding of both the impact of intrafamilial child sexual abuse and how a child's distress resulting from abuse may show in their behaviour, and recognise the need to provide support that responds to children's needs. We still have colleagues saying we can't proceed because we have yet to have a disclosure from the child. What we need to understand is that that disclosure is very, very unlikely. Many children will go through their whole education career without telling anyone. In fact, often we've got people who go through their whole adulthood without telling anyone. And we often talk about having really secure evidence in order to progress and to air our concerns, discuss our concerns, and make a referral based on our concerns. And evidence is incredibly difficult to achieve in this space. How would we definitely know that beyond all reasonable doubt that child sexual abuse has taken place? It's an incredibly high threshold to reach, and the police have a threshold that is much higher than our services. So the police threshold is beyond all reasonable doubt. That's the threshold that they need to reach in order to take a charge to court. And these are some of the bits of evidence or the examples of evidence that might allow the police to do that and to take that step. But look, if we just take one or two of these, admission of guilt from the perpetrator, highly unlikely to happen. Witnessed by somebody else, again, highly unlikely to happen. Possibly, within a family context, another sibling might witness that harm or abuse, but whether they get a voice and whether that voice is listened to may not happen. Where we do get higher rates of conviction is where there is an electronic footprint, so where there are images that exist of that abuse on devices. So rarely are we in a position of absolute knowing, and so our role is to look at I guess other signs and indicators in the behaviour of the child, in the environment of the child, and those who are around the child, in order to build a picture of concerns. And this is really kind of summarised in this slide here. We simply cannot wait for children to talk to us. It's quite frankly an unreasonable expectation. If we have got concerns, it is up to us to explore those and to think about how we might collect information from other areas in the child's life. Now, there's a little short video here just to introduce our signs and indicators template, which I'm going to play. It's about 2 minutes long.
Our signs and indicators template is designed to support a common language among professionals to identify, discuss, record and share concerns that a child is being or has been sexually abused. To intervene to protect children who may be being sexually abused, we need to build a picture of concerns. Not just the signs and indicators a child may be showing, but also the potential indicators of sexually abusive behaviour in those who may be abusing them. Additionally, some factors within the child's family or environment may increase opportunities for abuse to occur, and therefore also need to be considered. As professionals, it is our job to be alert to wider signs and indicators that something isn't right for a child, and explore all possibilities of what might be happening to them. We know there are many challenges to uncovering child sexual abuse. It simply isn't likely that a child will feel able to tell us directly what is happening. The responsibility is on us to gather signs and indicators of possible abuse, build a picture of our concerns and the child's experience, and work out what to do about them. In our signs and indicators of child sexual abuse template, you can record and make notes of the signs and indicators of concern. As you work through each section, you will quickly be able to build a picture of your concerns, all in one document. Remember, a child who is being sexually abused may show no signs at all that they are being abused, or they may show many. Of course, the signs they do show could also be indicative of something else that is happening in their lives. Please remember, Child sexual abuse can feel difficult and complex, but by all working together, we can tackle this. Do download the template and see how it could help in your role.
So as the that short video it sort of introduced the resource, it is really about I guess creating a common language amongst all professionals to discuss and to record and to share their concerns if they think a child is or has or is at risk actually of being sexually abused. What we would say at the Centre of Expertise is that anyone who is working with children should be able to have a conversation with that child if they do have concerns. And I guess, you know, to kind of overcome some of the barriers and challenges in terms of the confidence in identifying those concerns, it is really a helpful exercise to use that template and to think about how we can sort of populate that to really build that picture that might help us to make a really secure referral. Or, you know, the decision might be that you, once you've completed that template, perhaps with a colleague or your safeguarding lead, you might decide that actually this doesn't meet threshold just yet, but we're going to keep this document live and we're going to add to it as other concerns may come to light. As was mentioned there, the template focuses on 4 areas. So the behaviours that the child might present, the kind of physical signs that children might present, behaviours of those around the child. So again, thinking about adults who might pose a risk to children. Sadly, in you know, when we did the field work for the National Panel Report, we reviewed 140 plus rapid reviews where child sexual abuse was a theme intrafamilially, and about 40 plus serious case reviews, local safeguarding practice reviews. About a third of children were abused by somebody who was known already to be a risk to children or had already committed offences against children. So and then other environmental signs that I mentioned earlier about kind of neglect and substance use and those sorts of things. In terms of some of our other resources now that I'm going to take you through, we have got just a wealth of resources that are available on our website. So I'm really encouraging you to do visit it and sign up to our newsletter. We don't bombard you. We'll only tell you when there's something important to tell. So, for example, in January of next year, we've got an update to one of our key messages from research. So again, if you were on our mailing list, we'd let you know about that. So we certainly don't bombard you. But the child sexual abuse response pathway is an interactive online resource. Again, you just jump on a website, scroll down a bit, it will take you to the pathway, and then it really takes you through all the different avenues, all the different types of scenarios that concerns may have come to you. So it could be that you have concerns yourself about a child, but they've not spoken to you. So it will take you through a pathway of what you need to be thinking about, what sorts of decisions you might need to be making, who you might need to include, right through to sort of the criminal kind of justice process and response. In addition to that, we've got a number of practice guides. We've mentioned the signs and indicators one today. The Communicating with Children resource is probably one of our most frequently downloaded resources that we've got. It's just brilliant. All of our resources are great, and I can say that because my colleagues have worked incredibly hard on them, and our reviewing process engages a really high number of kind of partners, including victims and survivors who review our resources and our training. We also have one that is about sibling sexual behaviour as well, but I don't have a slide for this in this slide deck, but I will include it in the PDF copy of the presentation that Steve said you will get at the end of this. I mentioned our key messages from research. So these are put together by, again, our research and evaluation team. So they're really kind of succinct documents that kind of pull together the most up-to-date research for practitioners. And we've got, again, a huge range of topics. There's some examples included there on the slide, but many more when you visit the website. Alongside our data hub, we've also got a support service register, if you like. So you can dive straight in and look at the support services in your area if you visit the data hub, but you can also, scan this code here and search by location, and it contains the support services for all those who might be impacted by child sexual abuse, including children and young people, parents and carers, adult victims and survivors of child sexual abuse. It's absolutely confidential to access. You don't have to sign up at all, and no information is saved when people go in to search for support. Those seeking help can also find sort of local and national services offering, really bespoke and focused support. So, for example, for women and girls or men and boys, the LGBTQ plus community, disabled people, and also for people specifically from ethnic minority backgrounds. And it's a really valuable tool, I think, for professionals who are working with those who've been affected by child sexual abuse to quickly, find and then recommend support that children and adults that they work with can access. Now, we are updating this again into the next year. I think it'll be no surprise to you that funding pressures nationally mean that sadly the number of services that have been available this year will actually go down next year. So that's the state of the nation, but it is nevertheless a really useful resource. I think there are nearly 400 services listed on there. Some of them national, some of them very local and niche. So coming to a close now. So we always include this slide in much of our training. So if you have any worries about your own thoughts or behaviours, or you're worried about the behaviours of somebody else in your network, you can contact Stop It Now for free and confidential advice.